Hello, dear AME community. What do you mean by Indriya Pradoshaja Vikara? How to understand Indriya Pradoshaja Vikara? What do you mean by Upaghata and Upatapa? These are the questions that will be answered in this particular video, along with the current understanding. Please subscribe this particular channel and put a like button and spread this particular video to maximum number of true Nidana learners so that the algorithm of YouTube identifies the uh, right video at the right time for the right audience. Term Indriya Pradoshaja Vikara comprises of three words Indriya, Pradoshaja, and Vikara. Pradoshaja in the sense there will be a kind of a dysfunction of the Indriya, wherein the diseases will be manifested in the individuals. That is considered to be Indriya Pradoshaja Vikara. The textbook says Indriyani samashritya prakupyanti yada malaha upaghatopatapabhyam yojayanti indriyani te. Yada malaha indriyani samashritya upaghata upatapabhyam te yojayanti. So in the sense, the abnormally vitiated pathogens or mala, as such, if they are afflicting the indriya, that will be responsible for the Indriya Pradoshaja Vikara. The term Indriya Pradoshaja Vikara is comprised of two words, Upaghata and Upatapa. Here, the Indriya that has to be both Jnanendriya and Karmendriya should be considered. Jnanendriya, that is the Jnanendriya refers to the Tvak, that is the skin, Chakshu, eyes, Ghrana, that is the nose, then Shrotra, that is ears, and Rasana, that is the tongue. Whereas Karmendriya refers to the Vak, that is the vocal cords as such, Pani, that is the upper limb, Pada, that is lower limb, Payu, that is the anus, and Upastha, that is the external genitalia. So they are considered to be Indriya as such. Whereas the Indriya Pradoshaja Vikara refers to the pathogens are entering into these Indriya, that will be either Jnanendriya or Karmendriya, or there will be dysfunctioning of the Jnanendriya and Karmendriya are happening. That is considered to be the Indriya as such, and Pradoshaja, that is where the dysfunctioning is happening or pathogens are entering into these Indriya. This Indriya Pradoshaja Vikara is actually having the two words, Upaghata and Upatapa. Upaghata refers to Vinashaha, that is complete destruction of the Indriya will be taking place. Whereas Upatapa refers to Kinchit Vaikalyam. Vaikalyam in the sense there will be partial dysfunctioning may be happening. That is what we can say the Upatapa. In other words, Upaghata refers to complete destruction of Indriya, leading to severe dysfunction. Sometimes that may persist throughout the lifetime of an individual. Whereas Upatapa refers to partial destruction of the Indriya, which may be considered to be ranging from mild to moderate dysfunction, which may persist in an individual for a shorter time period or a little bit longer time period, but not as the Upaghata as such, wherein the dysfunction may remain throughout the lifetime as such. That is considered to be Upatapa. Now, let us look into these Upaghata and Upatapa in terms of the different Indriya. When you think about the Shrotrendriya, the Upaghata refers to the permanent disturbances, disability of the hearing dysfunction. Maybe the inner ear dysfunction, what we can say, that is the Upaghata as such. That is where we can say the cochlear dysfunction. We can say that is Upaghata as such. Or there may be a possibility of dysfunction in relation to the nervous conduction from the inner ear to the brain. If that is there is the dysfunctioning, then we may say it is Upaghata as such. Whereas Upatapa refers to partial dysfunction, maybe in terms of the external ear, such as the excess wax accumulation in the external ear, or impairing membrane rupture. As such, in terms of the middle ear, there may be what do you say that ear ossicles fracture, or there may be middle ear infection, or there may be possibility of the what do you say that the paranasal sinuses affliction, that is sinusitis as such, where there may be a possibility of the pain in the ear may be possible. So like that, they are considered to be upatapa as such. In a sense, where this the disturbances may be remaining for a shorter period of time. When you think about the Chakshurindriya, that is Upaghata as such, what we can say that is this is considered to be the cornea. If there is the blindness happening, for example, if there is opacity is being present somewhere in the this particular area, then we may say that there may be a possibility of the permanent disability, meaning this opacity may actually impede the overall visual pathway, or otherwise if there is any vitreous humor dysfunction, vitreous humor if that is getting damaged, in that particular situation the person may have permanent disability of the vision as such. Or otherwise, if the person is having the total opacity of the lens, what we can say in the case of the cataract as such, in that particular situation, the person may have the upaghata as such. Whereas upatapa refers to, for example, dust exposure to the eye while entering into the dusty atmosphere, which may lead to the itching around the eye, etc., etc., or otherwise conjunctivitis, wherein the Chennai eye, in that particular situation, conjunctivitis, where the person will be having the burning sensation or redness of the eye, conjunctiva may be observed there. That is considered to be the upatapa as such. Or even we can say any kind of the disturbances in relation to the iris as such. If there is any disability, or if there is any what do you say that this third cranial nerve dysfunction, where there will be ptosis, etc., they are considered to be upatapa as such. When you think about the Rasanendriya, carcinoma of the tongue is the classical example of upaghata as such. Whereas the hypoglossal nerve dysfunction, wherein there will be the total the motor functions of the tongue that will be afflicted, this can be considered as upaghata as such, where there will be severe form of dysfunction of the tongue may be observed. Whereas upatapa, wherein the consumption of a very hot tea, which may lead to the destruction of the taste buds for the shorter time period, that is considered to be upatapa. Or otherwise, the ulcer on the tongue, wherein the ill-fitting dentures, etc., that may lead to the what do you say that the disturbances in relation to the tongue as such. Or otherwise, we can say this is considered to be the tonsils as such. When you consider the swelling of the tonsils, the person is not in a position to swallow the food substances. Again, it is a functioning of the Rasanendriya dysfunction itself. So in that way, the upatapa refers to the partial dysfunctioning of Rasanendriya. So here, this is an example wherein the candidial infection is a fungal infection of the tongue, which is considered to be the upatapa as such, where the person may not be having the taste perception properly, or otherwise the swallowing difficulty may be observed there. And when you think about the Jnanendriya, suppose if there is a upaghata refers to olfactory nerve dysfunction. For example, if there is any nasal bone fracture, in that particular situation, there may be a possibility of olfactory nerve damage, which may lead to the permanent disability of imperception of smell may be observed. Or otherwise, in case of the paranasal sinuses, wherein the there will be the blockage that may happen in the nose as such, which may lead to dryness of the secretions. Thereby, there will be perception of smell may be damaged. Or otherwise, if the person is having the excessive running nose, or otherwise if there is post nasal drip as such, or otherwise if there is a regurgitation of the food, wherein the food will be entering from the oropharynx to nasopharynx, thereby that will be eliminated through the nose. That is what we can say. These are the different examples of upatapa as such. Whereas the Sparshanendriya is concerned, Upaghata, specifically carcinoma of the skin as such, that is considered to be the best example for Upaghata as such, wherein we may lose the life of the person within a short possible amount of time. Whereas Upatapa refers to other skin ailments, where other than malignancy. For example, here, this is the skin lesion, which is considered to be Upatapa, wherein the lady may be having the, what do you say, that the simply the disfiguration, discoloration may be observed, or otherwise simply the itching, etc., that may be observed as such, that is considered to be Upatapa. So that means the lady may be having the milder form of the complaints, which may not lead to death as such. That is considered to be Upatapa. As far as Vag Indriya is concerned, here Upaghata refers to the complete vocal cord paralysis that may be happening either due to the vocal cord dysfunction, or that may be happening because of the disturbances in the muscles of articulation of speech, or there may be the brain dysfunction may be observed, which may be termed as aphasia or anarthria or aphonia as such, wherein the term aphasia refers to the person who is not able to produce the words as such, or he is not in a position to comprehend the spoken words, or he is not in a position to read the words, or is not in a position to write the possible words. That is considered to be the aphasia, wherein the speech faculties such as listening, speaking, reading, and writing may be difficult. That is considered to be aphasia. So here, site of the lesion that may be present in the brain, whereas anarthria, wherein the site of the lesion may be present in the muscles of articulation of speech. When you think about the pa, ba, ma, etc., the lips are as such that will be difficult to pronounce the words. Whereas ta, da, na, etc., we are going to say the palate affliction may be observed. So if the person is not able to produce any of these letters as such, then we may say that the person is having anarthria. Whereas aphonia refers to where the person is not able to produce the words itself. That means vocal cords, they are difficult to pronounce the words as such. That is considered to be upaghata as such. Whereas upatapa refers to the hoarseness of voice in case of upper respiratory tract infection, or otherwise the person is having dysphagia, that is partial the disturbances, partial discomfort in relation to the site of the lesion of in the brain, or dysarthria, whereas the part of the muscles of articulation speech they are being disturbed, or dysphonia, where the part of the vocal cords that may be afflicted, that is considered to be upatapa as such. Whereas the hasta, as the affliction is concerned, whereas upaghata refers to brachial nerve palsy. Brachial nerve palsy in the sense where the brachial nerve damage may be observed, where the person is not able to do his routine activities, or otherwise cerebrovascular accident, where the upper limb may be afflicted, such as monoplegia. There may be upaghata acid that can be observed. Whereas Upatapa refers to inability to hold these substances or inability to write using the pen or inability to draw or inability to do various activities such as the removing the cork of the bottle, etc. So, or combing the hairs, they are being difficult, etc. That may be considered to be Upatapa as such. When you can think about the Pada, Upaghata refers to where the injury leading to paraplegia. The term paraplegia refers to the loss of strength of both the lower limbs, wherein the person is unable to walk itself. Sometimes the person may be having the loss of a bowel and bladder control may also be present. So here, as such, that is considered to be Pada Indriya that may be afflicted. When you think about the Upatapa, that is pain that may be present in the lower limbs, either that may be present in the one lower limb or both the lower limb, or otherwise the osteoarthritis of the knee, where the person will be having pain in the knee joint. So that is considered to be Patapa. Or otherwise pain in the hip joint, or pain in the feet or ankle joint, etc. So they are considered to be Upatapa as such. As far as Payu is concerned, Upaghata refers to fecal incontinence or anal carcinoma. Fecal incontinence in the sense where the person will not be passing the formed stool. As soon as the fecal matter enters into the rectum, the same will be eliminated as liquid form through the anus. That is what is considered to be fecal incontinence or anal carcinoma, wherein the cauliflower-like growth will be observed in the anal canal or anus, wherein the person will be having the the fecal matter that is very hard fecally that may be passed, which may be persistent till the death of the person itself. That is considered to be Upaghata. Whereas Upatapa refers to the bleeding happening per rectum or passage of hard fecales. That is considered to be Upatapa, or passage of the pus through the anus, or the person will be passing the liquid stools, or the person is passing the mucus mixed stool. All these are considered to be Upatapa as such. Or the pain after defecation, which may be observed in case of the fissure in ano, etc., are considered to be Upatapa. As far as Upastha is concerned, Upaghata refers to urethral stricture, where the person is actually unable to pass the urine as such, or otherwise urge incontinence, etc. So that is the urine will be passed. That is as when the person is getting the urge itself, he is not in a position to withhold that particular urge itself. That is considered to be Upaghata as such. Whereas Upatapa may be dysuria, that is painful micturition or burning micturition, or the pain which is radiating from loin to groin, etc., or hematuria, that is the passage of blood along with the urine, or pyuria, the passage of pus in the urine, or there may be a possibility of sexual dysfunctions, etc. In case of the male or female, they are considered to be pastha. That is the upatapa of the pastha indriya. So this is how we can able to understand the upaghata and upatapa. To sum up, Indriya Pradoshaja Vikara is another method of identifying the dysfunction that's happening in the human body from the perspective of Indriya. So whenever if you're thinking about the Indriya Pradoshaja Vikara, we have to consider both the Jnanendriya, that is Vak, that is Chakshu, Ghana, Nasa, Shrotra and Tvak. Whereas Karmendriya, Vak, Pani, Pada, Payu and Upastha, that should be considered in case of Indriya Pradoshaja Vikara. Whereas Upaghata and Upatapa, they are the two varieties of Indriya Pradoshaja Vikara, wherein Upaghata refers to severe form of the dysfunction, complete destruction of the Indriya itself, and Upatapa can be mild to moderate form of dysfunction of the Indriya can be considered. Dear ANA community, what are the major key takeaways from this particular video? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Subscribe this particular channel so that you are getting the right information at the right time so that the algorithm fetches the right videos for your likes as such. That's all for today. Something more in the next video. Thank you.